Hello friends, today we are going to talk about a very interesting topic. Is your headache migraine? So we get a lot of patients in our OPD who come to us telling us that they have migraine since a lot of years and they are taking treatment for it, but they don't have relief or they have to keep consuming painkillers. So whenever they come to us, first thing that we try to assess is whether the headache is really migraine or is it a headache due to some other cause. So how will you know that your headache is migraine? So first and foremost, migraine headache is not a mild headache or just an ache which you can continue your work with or you can ignore. Migraine is a severe type of headache and it affects your day-to-day activities. Secondly, migraine headache is often one-sided and it's a throbbing type of headache, like every pulse of your heart, and that leads to a surge in your headache. Thirdly, this headache often we can find some or the other trigger. Like the trigger could be either you've not eaten on time or you've not had enough sleep or you've had some important project at work due to which your screen time has increased. In women, it often coincides with the menstrual cycle. So you have to identify your trigger and notice it every time you get a headache. Fourthly, along with a migraine headache, often there will be nausea, vomiting, also any vision disturbances like blurring of vision, or there could be a sensitivity to light, sensitivity to sounds, any different kind of sounds that may be heard. Fourthly, migraine headache may or may not respond to your regular over-the-counter painkillers. It's a severe type of headache and the patient often wants to ignore all his other work and just take rest. So if it's not a migraine headache, what is the most common headache? So the most common headache is called as a tension type headache. So this means a headache which occurs due to increase in the tension or the spasm of the muscles of the face, the neck and the scalp. So these muscles become very tight and that is why they lead to a headache. This headache can happen every day and it is mild to moderate, causes a dull ache all over the head, and especially in youngsters. Even migraine is most common in youngsters. So the purpose of this video is mainly that if you have a headache, please do not keep on continuing to take medication from the pharmacist, because treatment of every type of headache is totally different. So consult your doctor, diagnose yourself accurately and get good treatment. For any more questions, please write to us in the comments. Thank you.